the CARES Act money, especially for our current grant, while it is specifically targeted for autism and developmental disabilities, what we did with it and what we have been able to help other organizations and committees do with it has been for all children. As I mentioned, we're a very big screening state. We have a very strong EPSTD schedule with the autism screenings in there also. They're mandatory at different age points. But one of the nice things is being on different committees. For instance, our ICC oversees our early intervention. And about 12 to 16 months into the grant, I was at a meeting and went into one of the breakout meetings, and it was about how are we going to get this information about screening and developmental tracking, use the Learn the Signs Act early materials. How are we going to get that to the in-home daycare people? And I was bouncing out of my skin. As, you know, I said, can I remind you what our current HRSA grant is? And they were thrilled. And so we just upped the ante because they had more contacts for us as to who should get the training on. And our training, just to clarify, is we go in and it's a 1-hour training on what does typical development look like. And it's all based on Learn the Signs Act early materials. We bring them with us. We get everybody to download the app in the training. And after that, we say, now, if you know what typical development looks like, if you see atypical development, this is how you have a conversation with a family. This is how you bring the information to them and gently nod them along to a screening. We're not going to do screenings. We're not going to teach physicians how to do screenings. Our role is to get you to understand how to have a conversation with the family so that their child is screened. And by doing our Salesforce regional model, it really worked to get people in front of the early learners. They were so excited about this training. First of all, so many need that on just general development, and then for a lot of the groups, we would do another hour on atypical development and autism and DD and what it looks like and how to support them. So it's been very successful. Over 3,000 people have been trained through this grant on the ground workforce. That's who we went for. So I think it's really up the ante for all children. We have a very strong EI here in Rhode Island. I think we're number 2 now. Which is not good for increasing by 25%, by the way, but we get kids into early intervention, and there's still more children who aren't in early intervention or early Head Start because they don't pick the lottery. So this has been very good to get the information out. So the Department of Ed, every child, every year for screening. So we're working towards that too. And this grant has really helped us, help them, help their workforce get the information to get the kids screened.